Why are you sitting over there? Okay. Okay, so the first thing I would do is check the medical chart. I'm going to perform hand hygiene, put on PPE if I need any, and then I'm going to go in the patient's room. So knock knock, my name is Amanda, I'll be your nurse today. Can I identify you with 2 identifiers? What's your name?
Emily.
Date of birth?
10/26/97.
Okay, and then I'm going to ask subjective data. So, any recent constipation?
No.
Diarrhea?
Mm-mm.
Any abnormal bowel movements?
No.
No green, no black, no tarry, nothing like that?
No.
Okay. Have you had any surgeries?
No.
You haven't had any surgeries to your abdomen?
Yes, I have.
What have you had?
It was for a hernia when I was like 10.
Okay. So, did that obstruct anything, or do you remember?
Nope.
Okay. So, I'll make a note that she had a surgery to her abdomen. Do you have any past history with your family about constipation? Any irritable bowel syndrome? Nothing like that? Okay. So then I'm going to explain to the patient that I'm listening to their bowel sounds, and I'm going to listen to their bowel sounds. And then I'm going to go in and palpate to make sure there's no abnormalities, and then I'm also going to lightly palpate and then go back in and deeply palpate. First thing I'm going to do is have the patient lay down. So I'm going to have you lift your shirt up, making sure they can see me. So what I'm looking for right now, before I even touch anything, is I'm looking as the light falls on her stomach to see if it's symmetric. I note that she does have a scar from her surgery, so it's right above her umbilicus, so I would say in her epigastric region. So I would note that, and everything else looks great. So the first thing I'm going to do is auscultate. You want to make sure you auscultate first before you palpate, because if you palpate first, you'll disturb the bowel sounds and it might make them louder or it might make them weird. So you want to auscultate first. So the order I'm going to follow is the right lower, the right upper, the left upper, and the left lower. And I'm going to follow that pattern as I do everything today. So, I'm listening at 2 places for each region. Okay, everything sounded normal. I would say it's normal, not hypoactive or hyperactive. It was pretty good. Now I'm going to go in and listen with the bell side. I'm going to put my hand down like this, and where the V is, I'm going to listen here, and then flip it upside down on her umbilicus, and then I'm going to listen down here as well. So I'm using the bell side to make sure I can hear everything clearly. Okay, Everything sounded good. I'm listening for her pulses there, and then I'm going to flip it upside down. And then I'm going to go up to the 5th intercostal, and I'm going to listen to the aortic there. Everything sounded good with that. There was no bruise noted. It all sounded normal. I could hear it very distinctively, so that's good. So now I'm going to go in and palpate. Like I said before, I'm going to do it lightly in the same motion I did before auscultating, and then I'm going to go back in deeply and do the same thing. So I'm going to start at the right lower. And I'm going to the right upper. And I'm going to the left upper. And then the left lower. Then I'm going to go back in and do deep palpation. Any pain or tenderness? So I'm minding that scar she has for any tenderness. Okay, everything felt normal. Now I'm going to go back in that same motion again, and I'm going to percuss. Okay, so I percussed in 3 different spots that time because when I went up to the right upper, I percussed over her rib, and I wanted to note that the sounds are different just for my learning. So I listened to 3 areas instead of 2. So then I will inform the patient that I'm done with the assessment and ask them if they need anything. Are you comfortable? Okay, put their call light in reach. Then I'm going to leave the room, wash my hands, and chart what I just did.